From 89.7 WUWM, Milwaukee's NPR, this is Lake Effect. I'm Joy Powers. Today we'll look at the historic flooding from over the weekend and ways to prevent more flooding in the future. Then we'll learn about the risk of measles spreading in Wisconsin, now that cases have been confirmed here.
This is one of the most contagious viruses out there. If you're in a room, there's about a 90% chance that you're going to be exposed to this virus if somebody else has it. So it's an extremely contagious virus.
Plus, we'll learn about upgrades coming to some of Milwaukee County's community centers.
This is going to allow us to supply, new workout room equipment, right? New furniture, computer lab upgrades, and give us the ability to really support much of the programming that we already have in these community centers.
All of that is coming up on Lake Effect. But first, here are today's headlines. This is Lake Effect from 89.7 WUWM, Milwaukee's NPR. I'm Joy Powers, and thank you so much for joining us. We'll start today with the historic flooding we had over the weekend. Some parts of Milwaukee County got over 10 inches of rain. Events like the final day of the Wisconsin State Fair were canceled, and roads were closed. Though the flash flooding has subsided, standing water still presents risks. Here's Katie Rusnellos with Wisconsin Emergency Management with some tips on how to stay safe in high water.
Some things to keep in mind with severe weather season is when there is flooding, whether that's river flooding or flash flooding, please do not drive your vehicle into flooded water. You don't know how deep it is. You don't know what's in it. The same goes for walking in the water. We've all seen those videos of people sloshing in the water, walking up and down the streets, or kids playing in it. The problem with that is you don't know what's in the water. There could be liquids that are contaminating the water. There could be dangerous items that you don't see because they're covered in water that you walk on. And with floodwaters, it only takes 6 inches to knock someone over. And that could potentially be a deadly situation that you would find yourself in. Think about in those summer months when you have all your windows closed and the air conditioner is running, you're not going to hear that outdoor siren. So it's important to have multiple ways to receive emergency alerts. That could include having those wireless emergency alerts on your phone turned on for emergency weather information. What happens with those is the National Weather Service will send then a little alert to your area where you are located at, and it will tell you, hey, there's a tornado warning. There's, take shelter now. Other things would be having an NOAA weather radio, and those are good things to have because not only can you plug them in to an electrical outlet, they also can have batteries in there. So if there's a power outage, you can still get those alerts even though the power's not on because it is a battery-operated radio. And other ways to get those alerts are getting a weather app on your phone that can give those weather alerts to you, getting a phone call from family and friends, or even getting that information from your local TV or radio station.
That was Katie Rusnellos, the Public Information Officer for Wisconsin Emergency Management. Homeowners and businesses throughout the area are dealing with basement flooding. Earlier this year, a group of UW-Milwaukee graduate students partnered with Wisconsin's Department of Natural Resources to look at the flood risk in our area. That report, called Rising Waters, Rising Costs, looks at how flooding has already impacted Wisconsin residents and what can be done to prevent it in the future. Here's WUWM's Jimmy Gutierrez speaking with the graduate students about the report.
Can you tell me about the impact that flooding has in Wisconsin? What did you all learn about that?
Sure. Flooding is the most common and most costly natural disaster in the state of Wisconsin. And with the effects of climate change, it's expected that more frequent and severe storms are going to increase the amount of flood damage that takes place. So municipalities around Wisconsin are working really hard to shore up their own mitigation techniques. But even if you have the best mitigation techniques, there's still always going to be flood risk, which is why we try to emphasize the adoption of personal flood insurance policies.
What makes like an area susceptible to like flood risk or flood damage?
In the city of Milwaukee, it's susceptible to flood damage because there's a lot of impervious surfaces here. And
so like looking around a neighborhood like this where you can see large buildings, abandoned manufacturing, a lot of hard surfaces, very little trees. This would be like a pretty prime example of like impervious surfaces and like susceptible to flooding.
Yep, exactly. And within this area, in our report, we looked at the socioeconomic indicators, but a lot of that is areas where it was all hardscape now because of the community and the history of the urbanization of people, I guess.
Socioeconomic mapping.
Yes.
What is it? Why does it matter? And what does it tell us about flooding and how to keep people not wet?
Okay, so FEMA has normally been the historic kind of like landmark figure that delineates 100-year floodplains, which is kind of what Evelyn was just talking about. And these floodplains tend to have a lot of prior data mapped on them. It's what like local municipalities, other things are kind of relying on when they're trying to prepare for any flooding disasters that are going to happen. But then again, there's a lot of floodplains that aren't actually mapped by FEMA, or the ones that are mapped, just it's old data. It's not really focused on socioeconomic indicators. So there's a lot of things that could go wrong there where municipalities aren't really prepared. So a really important thing is not only to apply like ecological things when you're mapping for FEMA, but also applying in socioeconomic indicators, and that can range from like, okay, how many people have like diabetes in this area, to a large thing we focus on was like renters and things like that, because there's the ability to kind of recover from a big natural disaster changes like drastically whether you own your house or whether you're a renter in terms of if you got that insurance or anything. Hurricane Katrina and Hurricane Harvey were excellent examples that we utilized in our report that really showed how much more renters suffered, and then especially Black and Hispanic populations in the area. So there was one really great project by Groundwork Milwaukee, and I'm forgetting their other partners they were working with, but they specifically focused on Milwaukee as their case study and outlined a ton of socioeconomic indicators, again, ranging from diabetes to how many people are in the household, income, and countless others. I highly recommend reading through their report.
If we're talking about renters, which the majority of Metcalf Park residents are renters, what are some of the insufficiencies when it comes to like flooding insurance and then specifically dealing with renters?
Sure. So we talked earlier about flood zones. Flood zones delineate risk, and they're categorized from X to V, and each different region has a different level of risk. Things that are called SFHAs, or Special Flood Hazard Areas, SFHAs. Those are areas where you've got mortgage requirements to have flood insurance. So if you want to get a mortgage and you want it backed by the federal government, you need to have a flood insurance policy. And as a result, that's kind of the only regions where you see widespread adoption of flood insurance policies. There's currently no mandates for standard renters insurance to include flood insurance.
So why would they?
Exactly. And I think a lot of people don't understand their risks. There's been a lot of academic evidence to support the fact that people generally have really poor risk perception. They don't think it'll happen to them. And, traditionally it's been expensive. So flood insurance historically has always been operated by these two levels. It's private, which is relatively new, and the FEMA National Flood Insurance Program, the NFIP. And the NFIP covers the entire nation, right? It's been around since 1968. It's extremely debt-saddled due to these high extreme payout events like Katrina and Hurricane Andrew and Hurricane Ida. It's paying hundreds of millions of dollars every year just to pay off its own debt. And, future federal funding looks a little grim. So that's where private insurance needs to step up and offer more customizable options with different price points based on risk. There's a lot more advanced modeling that allows for them to create these more nuanced policies. But as of now, I think there's just a large amount of unawareness about flood risk, about flood policy options, and about the financial devastation that can occur if a flood event happens at your house.
All right, Evelyn, I've got a question, because if we're talking about how do you serve like underserved, underinvested communities, I feel like 30th Street Corridor, this right here in front of us is an example of that. So can you tell me a little bit about what you learned with the work with MMSD in the 30th Street corridor?
Yeah, so MMSD is kind of targeting those underserved communities, and infrastructure is really costly to fix over time. So to kind of combat that and take like a better approach, they're also implementing green infrastructure such as bioswales. And those are large stormwater basins that help capture water where it falls and prevent water from going into those pipes and over flooding that system, because then that's going to lead to a sewer overflow, which then dumps a mixture of raw sewage and stormwater into Lake Michigan, which we don't want. So this is kind of preventing that from happening. So they kind of just reach out to underserved communities and tell them about the projects that are happening and make them familiar with what's being done in their community, and then also kind of give them strategies that they can help implement, such as small-scale green infrastructure, like rain barrels and rain gardens in their own homes, which they help provide and educate the community on as well.
What surprised you about your study and just going through the data and learning what you did?
For me, at least, when looking at the data, just like the extreme number of like flooding blind spots that are missed in mapping. There's like a lot of flood risk hotspots where like there's significant pluvial flooding, which just means that the drainage systems, again, like Evelyn mentioned earlier, are going to be overwhelmed, and these areas are going to be heavily flooded and damaged. So looking at maps where you look at traditional FEMA mapping tools versus when you combine social vulnerability data, you'll see so many more communities that are going to be affected.
Yeah, and I guess I would just add to that, when you look at the insurance adoption, it similarly points to a lot of coverage gaps. FEMA data suggests the fact that over 80% of all residential NFIP policies are held by individual homeowners and not 2 to 4 family residences, which suggests a real lack of coverage for renters and people living in multiple unit buildings.
I'd say just learning about the 30th Street corridor projects and the basins themselves was super interesting as I kind of focus on the green infrastructure. I believe the West Basin, which is the larger of the three, can capture up to 31 million gallons of water, which is just really hard to even picture in your mind, like how much water that is. So I think that's really neat and cool.
What I'm hoping the story gets to is like the solutions part of everything, but I'm curious if there are other parts of the solutions and the takeaways that you all highlighted or featured in the report.
For mine, for people themselves, would be just to look into, like, MMSC offers programs for rain barrels and rain gardens. Just finding out what resources there are for you as a person to try to capture water where it falls and install your own small-scale green infrastructure, because that will help capture water where it falls and prevent flooding and overwhelming of the sewer system.
You should get flood insurance. It's estimated that 1 inch of flood damage can cause $25,000 worth of damage. I don't think people quite understand their risk. I don't think people are fully aware of the financial devastation that can occur with an uninsured flood event. There's a lot of flexible flood insurance packages, and there's a lot of government relief programs that are worth looking into if you're currently uninsured. It's definitely worth exploring. Get flood insurance.
That was UWM School of Freshwater Science graduate students Cami Armendariz, Joe McCormick, and Evelyn Grimm, authors of Rising Water, Rising Costs. They spoke with WUWM's Jimmy Gutierrez earlier this year. If you have questions about the flooding, WUWM is here to help. You can submit your question at WUWM.com, and we'll incorporate your needs into our reporting. Because of the heavy rain, the Milwaukee Metropolitan Sewerage District started a combined sewer overflow on Saturday evening to try and reduce the risk of wastewater backup in basements. They also issued a water drop alert, asking residents to use less water to help in their efforts to reduce sewage overflow. MMSD overflow releases happen a couple times a year, But during the so-called sewer wars, Milwaukee's sewer system released untreated wastewater into streams, rivers, and even Lake Michigan, an average of 60 times a year. MMSD, taking a green infrastructure approach under the leadership of MMSD's Executive Director Kevin Schaefer, helped change that. Schaefer joins Lake Effect's Audrey Nowakowski to share what changes MMSD has made over time to help during heavy rain events.
Well, in 1972, the Clean Water Act passed, and almost immediately after that, the city of Milwaukee was sued for combined sewer and separate sewer overflows into Lake Michigan by my home state, Illinois and Chicago. And so we were forced at that time to build the deep tunnel and to make improvements to our treatment plants. And so the sewer wars was a discussion about, it was a battle over who was going to pay for the deep tunnel and for some of those improvements, basically pitting the in Milwaukee County communities against the out of Milwaukee County communities.
And a big issue during this time was untreated wastewater overflowing into lakes and rivers. That was up to 60 times a year at that point.
Yeah, that's correct. We averaged 50 to 60 per year. So that was, there's much more than that in some years. And it was about 8 to 9 billion gallons of wastewater going into the rivers and into Lake Michigan every year on average.
Yeah, obviously today it's very rare for this to happen, but a lot happened in between that, right, to get us to where we are. And when you started as MMSD's executive director in 2002, what were some of the most pressing challenges you were facing at first?
Well, there was a lot of media attention, none of it real positive. And one of the things that was happening at the time was when we finished completion of the deep tunnel in 1994, we let an algorithm, a computer algorithm, kind of manage the tunnel system. And up until 2002, we would basically have an overflow if the tunnel was half full, because we were saving that extra space for future rainfalls. And, rightfully so, we were getting a lot of poor media coverage because we still had half the storage available and not using it. So in 2002, when I became executive director, first thing I did was change that. And instead of a computer making that call, I said, if I'm going to be out in the media defending an overflow, I want to be the one that makes that decision. So I guess I took the horns and said, I'm going to make this happen and I'm going to do the call myself. And that meant a lot of 2 o'clock in the morning phone calls, all night wake ups, just trying to manage storms. And but what it did was it really brought a more personal touch to what we were doing. And I think the public appreciated that.
Another big part of the shift you helped kind of lead was an emphasis on education in relation to public relations, because people can easily see the result of wastewater overflow, right? But do they understand the process necessarily? So why did you feel, let's help everyone understand what actually happens in our water system?
Yeah, and thank you, Audrey, because that was one of the big changes early on. We would have an overflow and people would not understand why and what the mechanisms were and what the background was on that. So one of the things I also started doing was, I call it sewer school. I'm still doing sewer school, and I go around to nonprofit groups, schools, communities, Rotaries, Kiwanians groups, and talk about how the system works. But one thing that I did do, which was different, and it's different than what most utilities in the country today are doing, is I connected it to the entire watershed. I said, we cannot just look at our own political boundaries. The Milwaukee River comes downstream right through our sewer area, and it's got a huge drainage area up above us. So we really need to look at nature's boundaries, which is that watershed boundary, and start managing all types of flows on the watershed scale. And so that's the message I've been pushing with the sewer school effort, talking about how we manage stormwater, how do we manage wastewater, how do we integrate these systems so that they can work together to make our lives better.
Given that it takes a lot of time to steer the ship right, so with the tumultuous environment you're coming into, it didn't go away overnight. And in 2009, you almost quit MMSD. But what was the turning point for you that helped you make the decision to stay and to essentially commit your foot to the gas?
So in 2009, my dad passed away. And I thought, if I'm going to make a change, I need to make it now, because I wasn't sure that I would make it going forward. And I thought, well, let's make the change. We'll see what happens. It's either going to be really quick or I'll be here a while. So what I did was I stepped back from everything they were doing, and I thought about a milestone year of the year 2035. And I said, what do I want the district to look like in the year 2035? So in 2009, I wrote a vision for the year 2035 that really was focused on integrated watershed management and climate change. And in 2009, although we were living it then, it was still not widely accepted that the climate was changing. So put some pretty drastic or hard goals within that vision, and hit the send key thinking, well, I'm either here for a while or I'm packing up tomorrow. And my commission wanted to extend it. So they wanted to have their own vision. So they formed a committee, took my vision that I wrote in 2009 and basically approved that same vision in early 2010. And really that vision is still driving us today. And it was a great motivator for staff. They were able to look at this and say, okay, we're going to take these steps. We're going to install green infrastructure. We're going to take these steps to try to address climate change while still meeting our permit with the state and federal government and doing better than those permit requirements.
Where are we at in meeting these goals you originally set out in 2009? How's our progress report?
Yeah, well, if you look at the integrated watershed side of the vision, it said 0 homes in the 100-year floodplain, 0 separate sewer overflows, 0 combined sewer overflows. And as you said earlier, it's very rare for us now to have an overflow. So we still have them during these extreme events, but it's much less frequent than it was before. So we're tracking really well towards the overflow goal. The flood management work, we also have flood management authority for the region. So we're building projects on the Kinnickinnic River, Menominee River, Lincoln Creek, working to try to keep water out of people's basements and out of their homes. And I would say, just rough numbers, we probably reduced the number of homes in the floodplain by half to 2/3 of what we had 15 years ago.
What's the current main issue that you're prioritizing right now for MMSD? I know a lot of projects happen together and along the same timeline, but what stands out to you?
Everything's integrated, just like you said. It's all kind of a puzzle that fits together, but we really have to turn our attention to climate change and really target these unique storms that we're seeing throughout the country now. It's a huge task that we have to embark on. And again, I think focusing that discussion on a watershed makes sense because the impacts of climate change will be felt with air and with water. And so using nature's boundary for water, it makes sense to try to manage that resilience effort through different steps throughout the watershed. So we're purchasing land and keeping it from being developed along the waterways where it would be flooded. We're working with farmers upstream to do better farm practices to reduce pollution and runoff from their farms. We're working in the urban core of the city and in the suburbs to install green infrastructure, which is just taking nature's approach to managing stormwater, allowing it to infiltrate or to store it in rain barrels or in ditches or whatever, to try to keep it out of the sewers and to clean it before it gets into the rivers. So we're really looking at all these different puzzle pieces fitting together.
Nowadays, you see rain barrels almost at every other house. A lot of people are doing rain gardens and their own personal landscaping. What are some of your favorite projects that you pass by in your day-to-day?
Yeah, well, I always laugh when I'm walking the dog in the morning when I see a rain barrel because you never saw those before. So it's very satisfying to see that. Pulaski Park it's a flood management project, but we went into that park in partnership with Milwaukee County Parks, and we removed the concrete lining from that waterway and naturalized that creek as it flows through the park, and then rebuilt the park so that it brings back better recreational components to the community. So really seeing that tie-in between the social benefits of better recreation, safe places for children to play, better places for families to gather, along with flood management, all kind of integrated into the same space, is very satisfying for me because you're getting multiple benefits for the same dollar amount.
Is it that satisfaction that's kept you at MMSD?
Oh, we do something different every day, and it's that change, that always looking to be better, the efforts to try to make this community more resilient to climate change with less flooding. That's the stuff that brings me every day. And mostly it's working with some really phenomenal people here at the district. We have great lab staff. We have great monitoring crews out in the field, engineering, accounting, my legal staff. Everyone is so passionate about what we do. And, we're really hiring some great young talent now. And a lot of them say that they're coming to MSD because they like the vision and the mission of what we're trying to do for the environment. So it's a win-win for everyone. And I just love the people that I work with.
Kevin Schaefer is the executive director of the Milwaukee Metropolitan Sewerage District. He spoke with Lake Effect's Audrey Nowakowski last year. Some upgrades are coming to Milwaukee County community centers. We'll tell you what's making it possible and what will change in about 10 minutes. But first, with 9 confirmed cases of the measles now in Wisconsin, we'll look at how well the state is prepared to fight the disease. That's coming up next on Lake Effect on 89.7 WUWM, Milwaukee's NPR. You're listening to Lake Effect on 89.7 WUWM. I'm Joy Powers. There are now cases of the measles confirmed in Wisconsin. The State Department of Health Services confirmed that 9 people have measles in Oconto County. The health department says the cases were contracted out of state, and right now there are no public points of exposure. Measles cases have now been confirmed in over 40 states, with more than 1,300 cases confirmed nationwide. Dr. Ben Weston is the Chief Health Policy Advisor for Milwaukee County and an associate professor at the Medical College of Wisconsin. He joins me to talk about what the measles outbreaks could mean for the state. What do vaccination rates look like in Wisconsin and Milwaukee specifically?
Yeah, so when we look at vaccination rates in Wisconsin, what we see actually is that we're quite a bit lower than most other states. So, for example, among kindergartners, this data is from 2023, but it's the most recent data we have. Only 85% of kindergartners were vaccinated against measles. And when we compare ourselves to other states, we're actually the 3rd worst in the country. We see this outbreak in Texas. We see cases exploding in Ohio now. We're far worse than either of those states with our vaccination rates. So we really are at risk here in Wisconsin.
Yeah. We're at around 85%. What is the percentage necessary for herd immunity?
Yeah, so we heard a lot about herd immunity back during COVID, and the basic idea of it is that if you get enough people vaccinated, it's just hard for the disease to spread because it can't really jump person to person to person very easily. And that number for measles is around 95%. Now, what's important is the measles vaccine is extremely effective, and that's why you have this herd immunity. The vaccine is about 97% effective. And so when you hit that threshold of 95% of folks vaccinated, it's just really hard for this virus to spread. And to give context to this, this is one of the most contagious viruses out there. If you're in a room, there's about a 90% chance that you're going to be exposed to this virus if somebody else has it. So it's an extremely contagious virus. But if we can get those vaccination rates high enough, we can certainly protect folks.
I think people are aware that it's contagious, maybe not quite as contagious as it actually is. They might not be quite that aware, but there are still people who look at the risks of measles and, for whatever reason, are not persuaded by these risks. If a child contracts measles, what can happen?
Yeah. So when somebody gets measles, it usually starts off, as many viruses do, with a flu-like illness. You might have fevers, you might have fatigue, congestion, cough. The problem is that in a fair portion of the population, it progresses and gets worse than that instead of just getting better. So 1 out of 5 people with measles actually gets hospitalized. That's a huge hospitalization rate, 20%. And then about 1 in 1,000 gets brain swelling. And even higher than that, 2 to 3 out of 1,000 people die. And that's why we're seeing, unfortunately, these deaths from measles. This fits with the statistics that we've seen. It fits with those 2 to 3 people out of 1,000 dying from measles.
Generally, who is most at risk of getting measles? Because I have certainly the perception that it is largely children, but obviously there are more people beyond that who can get it.
Yeah, anybody can be at risk for measles. Now, the people who are at risk of getting sick from measles tend to be younger kids, older adults, folks with immunocompromise. Now, part of that is because it's a newer trend to not get vaccinated. Our vaccination rates were much higher when you look 10, 15, 20 years ago. And so a lot of adults were vaccinated back when they were young. But a lot of kids these days are not getting vaccinated. And so that's, I think, why we're seeing more cases in young people. And then, of course, young people are in communal settings a lot more, that being school. And so being in school, you're just exposed to other people and you're more likely to have spread of disease. That's why all of us parents out there have kids who are congested and coughing all winter long. But thankfully for measles, there's an effective vaccine to prevent this more severe disease.
Do we know why vaccination rates are so low, especially in Wisconsin? We are the third worst for vaccinations for measles in the United States.
Yeah, across the country, we've seen a decline in vaccination, and certainly COVID was part of it, but it's been going on longer than COVID. When we look around Wisconsin, for example, we see significant declines over the last 10 years. So in Richland County, for example, in 2013, we were at about 83% vaccinated. Now we're down to 65%, just an incredibly low number of folks who are getting their vaccines. Bayfield County is another one, 86 or 87%, down to about 70%. And there's other counties that are even lower. Monroe County is down to below 60%. And so we have these counties throughout Wisconsin where the vaccination rates are getting so low that it just makes us a tinderbox waiting for an outbreak here as well, should a case of measles arrive in those communities. But certainly there's been a lot of misinformation, a lot of disinformation out there about the measles vaccine. But look, if you're a parent, there's 3 things you need to know. Number 1 is the measles vaccine is safe. It's been around for over 50 years. It's a proven vaccine. It's not anything brand new. We have tons of data on it, and it's incredibly safe. Number 2, it's incredibly effective, 97% effective against measles. And again, that data is over decades. And number 3, it's easy to get. The Milwaukee Health Department is offering the measles vaccine. You can call your local health department, drugstores, primary care providers. You can get the vaccine in so many different places. It's easy to get, it's accessible, and it's safe.
A lot of the counties you mentioned are in more rural parts of the state. And one of the things I think many of us have been concerned about is access to care just generally. Is Wisconsin right now prepared for a major outbreak of something like measles? How are we prepared right now?
Yeah, a few thoughts on that. I mean, any barriers we put up to folks getting health care broadly or vaccines more specifically are going to be detrimental to the health of individuals, the health of families, and the health of communities. Are we prepared? I think the vaccination rates show that we are not as prepared as we could be. Higher vaccination rates help to bolster a population and be more prepared when a disease emerges. And we're certainly seeing measles reemerge. It's important to remember 20 years ago, measles was considered eradicated from the United States. There were not cases of measles. And of course, now we're seeing this rise again. Funding public health, supporting public health, and getting information out there about the safety and effectiveness and availability of vaccines is going to be critical.
Now, if you're a person for whom vaccination is not an option, either you are unable to get it for health reasons, or perhaps you have a child who is below the age where it is safe to get one of these vaccinations, how do you protect yourself?
Yeah, I mean, the good news is the vast majority of people either have protection or are able to get protection. And so if you think that for some reason you are not able to get the vaccine, that's another great reason to talk to your healthcare provider. There's a lot of folks out there, I think, who have heard misinformation or disinformation about whether they're eligible for certain vaccines. And so if you think you're not, ask. verify. This is a great time to reach out and verify that really you might not be eligible, because that is a tiny, 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 tiny fraction of the population. But certainly if you're not in that category, you want to be cautious. And ideally, you want to go out and get yourself protected.
If the worst happens, if someone in your life gets measles and they are showing symptoms, when do you become concerned? When do you make sure you're in a hospital?
Yeah, so, measles starts off, again, in a very general sort of way with things that look like any other cold, any other viral thing out there. But then it turns into a rash, and then you can have the complicating symptoms. So certainly if you are unvaccinated and you're in the area of an outbreak and you start to have symptoms that seem like measles, even without the rash, that's a good time to reach out to a healthcare provider. If you don't have the vaccine, you don't have that protection. But for anybody out there, if you have these symptoms and then a rash starts to develop, you'd want to reach out to your healthcare provider for a couple of reasons. One is we need to track where measles is occurring and make sure it's not spreading to other people. And the other is to watch closely. 1 out of 5 is a large number of people that end up getting sick, getting pneumonia, getting organ damage, getting all these different things that measles can lead to. And so if you have those symptoms, you have that rash, or if you have concerns, reach out to your healthcare provider.
All right. Well, Dr. Weston, thank you so much for joining us here on Lake Effect.
My pleasure. Thanks for having me.
Dr. Ben Weston is the Chief Health Policy Advisor for Milwaukee County and an Associate Professor at the Medical College of Wisconsin. If you visit Milwaukee County's service and community centers, you might soon notice some new furniture and gym equipment. That's because Milwaukee County received a $250,000 prize for improvements to health equity in the community. The Robert Wood Johnson Foundation recognized 9 communities nationwide with the Culture of Health Prize. Milwaukee and Green Bay are among last year's recipients. The foundation highlighted several Milwaukee County efforts, including becoming the first jurisdiction in the country to declare racism a public health crisis and the deployment of harm reduction vending machines. WUWM's Eddie Morales is joined by Milwaukee County Executive David Crowley, who shares how the award funds will go back to the community.
This is really about recognizing communities who have been working at the forefront as it relates to making sure you can break down barriers and really advance health opportunity and equity for everyone. And so this is a very competitive process. It's been going on for the past 10 years, and communities all across the entire country apply to receive dollars and to be recognized for the Cultural Health Prize. And in this particular year, receiving the 2024 Cultural Health Prize was very competitive. First and foremost, it was the 10th and the final year of this prize. And we later learned that it was one of the most competitive year of the decade while giving out this prize. And for Milwaukee County to be one of the top applicants out of over 400 communities across the nation is something that we should be proud of.
This is the first and only time Milwaukee has won that award?
This is the first and only time Milwaukee County has won this award. I believe we have applied in the past before and never been recognized, but I think with the work that we have done in the past 5 years around our vision of achieving, becoming the healthiest county by achieving equity in all measurable areas, I think the work and the partnerships that we have created, the groundwork and the results and outcomes that we have been able to show really put us in a position to receive this prize. And it's going to allow us to continue to do more for our community moving forward.
Are there any specific initiatives or projects that come to mind that helped the county earn this award?
I honestly think that not sure if there's a specific initiative, right? But I do think that when we look at how we have created partnerships, right? How we have worked around health, right? The way that we've created our COVID dashboard, making sure to track, race and ethnicity and utilizing that to inspire other communities across the country to focus on their own dashboards. I also think when we look at what Milwaukee has been doing with our unsheltered homeless population and having the lowest unsheltered homeless count per capita than the other community across the country has put us in this position. But even as we think about moving forward, really letting them know what we want to be able to do with this recognition and with those dollars that we're going to receive. And so the way that we plan on utilizing these prize funds, we want to make sure that we can continue to maximize our impact, especially on some key projects. One, we recently just opened our doors to the Marshall P. Cox Health and Human Service Center, and we want to basically make sure that we're doing the outreach to make sure that folks are aware of the new location, but also the services that we provide. We want to use these dollars to help support and provide resources for those who are unsheltered near the Keene Park neighborhood. But also, we think about Keene Park, but also our Kosciuszko Community Center, which serves many older adults as well as young people, and how we can make some critical improvements there. And then when we talk about health, this is, we want to make sure that people can age in place. And so this is going to allow us to continue our membership as one of AARP's age-friendly communities, making sure that, people understand that, we're keeping our eyes on the North Star, making sure that we can become a healthy community. And it's not just the physical and mental health aspects, right? Because access to a good paying job is health. Access to affordable and attainable housing is health. Access to transportation, childcare, those things are health. And as long as we continue to work along those lines, focusing on the social determinants of health, improving the lives for our most marginalized communities, will put us in a much better position because they'll need fewer services, and we'll be able to invest in all the other programs and services that people rely on.
So the county's awarded $250,000 for this award. How will the county use those awarded funds to really recognize, highlight, and improve local projects and organizations that are doing this work in the community?
Absolutely. So, when you think about particularly our King Center and our Kosciuszko Community Center, we work with many different partners throughout the community who utilize these spaces. But many residents also come into here. And we want to make sure that when they walk into these community centers, that they have the equipment, they have the space, and they have the environment they need to work on their best selves. And so for those particularly two projects, this is going to allow us to supply, new workout room equipment, right? New furniture, computer lab upgrades, and give us the ability to really support much of the programming that we already have in these community centers. But it's also going to give us the ability to do special event sponsorships as well. How are we promoting health throughout our community so it becomes second nature for everybody, including those that we serve every single day? When we talk about supporting and helping people understand where our Marshall P. Cox Health and Human Service Center, we have to recognize that many people don't understand what county governments provide in general. And with the trajectory that we have been on social determinants of health and really tackling many of the root causes of the issues that face many residents in Milwaukee County, this gives us the ability to really go out and do that outreach, right? Explaining people what is happening with our Commission on Aging, what's happening with our senior centers, with our youth programming, birth to three programs, the behavioral health services. And so we know that we have to meet people where they are. And this is going to really, increase our ability and our capacity to go door to door, to meet people where they are, to make sure that they get access to these viable resources. But even if they don't need them, they're equipped with the messaging and the locations where other people can find these resources. And again, this takes partnership. So being able to work with everybody who is at the table, I had, the Medical College of Wisconsin represented and who accepted this award with us. We had the Milwaukee Parks Foundation. We had the United Community Center. Many of our community partners at the table, who has been helping us along this way. And this is really to help, broaden and expand our capacity in making sure that we can continue to reach the people we serve.
What is the timeline for distributing those funds, and what is the allocated amount? Is it differ depending on the projects that it's supporting?
It will depend on the project that we're going to be supporting, but again, we're going to be supporting a lot of different projects. I'm Eddie. I'm not quite sure exactly what the timeline is or with these dollars, but what I can tell you is that we know how to be prudent with not only taxpayer dollars, but grant dollars and foundational dollars that we receive here in Milwaukee County. And so what we want to do is not only get these resources out as quickly as possible, but we want to make sure they can have the greatest impact on our community as well.
Overall, what does this national recognition say about the work that's being done in Milwaukee County? And looking forward, what other neighborhoods or communities still need some more support? I mean, there's always work to be done. Is there anything that comes to mind?
When we think about communities that need support, I think all communities right now need support, right? I think, there's a lot of uncertainty in our country, in our state, as it relates to how local municipalities are able to pay for the services that we're mandated to allocate and give out and serve the people with. And so as county executive, it's my job to make sure that these dollars can be spread all across the entire county. Equity is about everyone. We want to make sure that we're bringing everybody's ideas to the table and that no community within Milwaukee County is left behind as a result related to this grant, excuse me. But I do think that what this means for Milwaukee County is that we're being recognized as a leader, right? That we're taking bold steps as it relates to making sure that equity is available, that we're providing opportunity, and that we're not running away from the challenges that we face, that we're running directly to them, acknowledging that we have challenges and working every single day to fix the things that are happening in our community. And I also think that it really speaks to the fact that we have the capacity to bring people to the table, whether we're talking, for-profit or nonprofit businesses, whether we're talking community leaders or residents or the people directly impacted by the policy decisions that we make, being able to bring them to the table, uplifting their voices. And so I think this really speaks to the fact that, we're working with everyone to really address the systemic disparities that we see throughout our community. And that is going to take all of us coming to the table to really create meaningful change. And so I think that's one of the best recognitions. Don't get me wrong, receiving, dollars to be able to do this work is always great. But the fact of the matter is that, we are being recognized as being a true partner and being a leader when it comes down to health equity.
That was Milwaukee County Executive David Crowley, speaking with WUWM's Eddie Morales. We'll take one more break, and when we come back, we'll get a reading recommendation to help your kids beat the summer slide. That's next on Lake Effect, on 89.7 WUWM, Milwaukee's NPR. This is Lake Effect on 89.7 WUWM. I'm Joy Powers. As summer comes to an end, many parents are looking to get their kids ready for the school year. A lot of students experience what's known as the summer slide, a slight regression in skills brought on by months of being outside the classroom. It's a predicament that Danette Justice is all too familiar with. Justice is an educator with Milwaukee Public Schools and the founder of Just Us and Books, a literacy program that introduces kids to new books. Danette joins me to share one of her favorite books. It's part of a series by author Nia Obatet called Exploring All I Can Do. So, Danette, tell us a bit about this book.
Well, I am excited for this first book. The name of it is called Fencing. This is a series that is written by a local author. Her name is Nia Obatet, and she writes about sports that people don't normally talk about. So, for example, this one is about fencing. I chose this one because we have a fencing tournament going on right here in Milwaukee, Wisconsin, and so the perfect book. But it's sharing with kids just things that they might not normally get to see. I mean, when is the last time you've ran into a kid who was interested in fencing? And the hope is that they'll hear or read this book and be like, oh, that's a cool sport. I want to try it. So, yeah.
It is a beautiful-looking book. The illustrations are really engaging. What is it that you think kids are really drawn to?
I think her style of writing makes fencing non-threatening. It makes it fun. She writes in a way that the sport of fencing seems fun. And actually in the story, the young man is very apprehensive. He wants to play his video games and he wants to, do all the normal teenage things. And the sister gets him to, join in. And he sees that not only do I love it, I'm actually good at it. So he kind of has a natural talent for it and didn't even know it. So, it's a win-win.
Well, and we were talking a bit before the interview. There is a very famous fencer who is African-American. I believe she was the first African-American fencer.
She was. Her name is Ittihaj Muhammad. She was the first African-American female to win a gold medal in fencing for the United States. And so I have this Barbie here that was gifted to me by the author, actually, to share during the read aloud. But now this lends itself to just a perfect summer research for kids to learn a little bit more about her, look up her videos, maybe see about her training. You've got some research and you've got a field trip that you can go to, and all tied into literacy.
That was Danette Justice, founder of Just Us and Books. At WUWM.com, you can find a video of Danette reading the book, Exploring All I Can Do, Fencing. Danette will be joining us to share more books throughout the month of August as we get ready for the new school year. And that wraps up today's show. Thank you so much for being here with us. I'm Joy Powers. If you missed any of Lake Effect this week, you can find all of our conversations at WUWM.com. If you'd like to take the show on the go, you can download the Lake Effect podcast wherever you get your podcasts. The weather in Wisconsin has been rainy, smoky, but most notably hot. Tomorrow on Lake Effect, we'll tell you all the best ways to stay safe during hot summer days. Thanks so much for joining us right here on listener-supported 89.7 WUWM, Milwaukee's NPR.